Good morning. This is Dr. Bill Wyatt again with the American Orthodontic Society, and I'm going to talk to you a little bit this morning about what I think is the very best way of dealing with lower anterior crowded teeth in early situations with children where their cuspids are beginning to come in on the side, and you've got four lower teeth here, the permanent teeth in, and they're crowded up, and you've got to deal with this problem. And what has been done in the past is people extract the deciduous cuspids. Surely they will just take one out. If you take one out, they all shift to one side, all your permanent teeth, and you have a problem there, and you may not need all the room. But the very best way to do it is to do a pulpotomy on the deciduous cuspids. And somebody will say, well, it's so much simpler just to extract the deciduous cuspids. But when you do, you take the root out. What you really need to do is just reduce the upper portion, and as the lower teeth come up, the incisal edge of the lower tooth is much wider than the root structure. It'll be out like this, and then it narrows down like this, and it'll line up later on down here. So just watch and see. I know several thousand of these pulpotomies, and they're simple if you just do them the way I'll show you how to do them. Then people can do them, and don't be afraid of harming or doing anything like that. You can just go in, and you don't need a rubber dam. You can't really put a rubber dam on the person like that. You'll be grinding it up first. So let's watch and see exactly how we do these things. And I'm going to go to I have to get my little red dot going here, and we're going to show this. This is the little girl that I've shown, and you can see the whole thing if you want to. We do actually 8 of these pulpotomies, bringing in somebody's teeth, and this is bringing in a young child's teeth like this. Now, okay, here I want to do it as quick as I can and take this little time of your time. If you're very careful, you can see the permanent lateral coming in on the left side. In other words, the lateral that fits right in here. Now that lateral is just a point of one coming in down here, and this lateral is also up underneath the edge of the deciduous cuspid crown. The resorbing cells that go in the little follicle over the tooth eat away the dentin, but when they get to the crown, the enamel portion of the crown, they cannot resorb it. And then if it's got a lot more root of stuff that's down in here, and you eat part of it away, the rest of it will hold it in place, and this tooth won't come in, and then these teeth will just more or less stay over on that side. Now what we want to do is come in and figure out how much room we're going to need for this lateral to come into. And so you can look on your x-rays, which I don't have a picture of the x-ray here right now, but you can take off the side of this cuspid and go down like this, and now you'll come into the canal, and then you just take I use a long carbide burr to go down. I used to use a diamond. Just get a brand new sterile carbide burr, and you just go right down the middle of this and just obliterate the cuspid, the pulp of the cuspid. Forget about it bleeding. In fact, you don't mind if it just bleeds and comes out. Now we'll show that, and this lateral is right in underneath here. And now when you do this, you have to come over here and take the same thing off, even though you don't need all of it. And if you get a child that's breathing right, swallowing correctly, functioning, everything good, the tongue right here will push those teeth into that place. And you just use nature. Nobody's teeth come in straight. They come in wherever they can get in, and the tongue and the cheeks out here push the teeth in place. If you swallow them properly or pull back the lip or do anything, take your thumb, your finger, anything you want to put in there, you can push these teeth out of place and they will not go to the correct position. All right, I'm going to erase this and we'll see what takes place next here. Now we're going to take a long tapered carbide burr. I use a diamond in this case right here. Now the other side of the mouth, you're going to have to do the same thing. You cut this off, but you leave the root down here. Now when this permanent cuspid starts in up here, if you pull this tooth, you've got a void in here, and this cuspid will move way on over, and you will lose arch length if you extract the cuspid teeth. I don't care who you are, and I don't really, I gave this lecture up in Boston years and years ago, and had people from three different pediatric schools there. And they had to put something special in the teeth. You don't need anything but real hard packed zinc oxide and eugenol. All right, we'll go on here to the next deal. Now here we are again, and you can barely see the left lateral tooth. It's peeking its head up there in that area. We'll take another look. Now up above, you're going to have to do the same thing. Now this picture was taken back when we didn't have to wear gloves, obviously. And we're going to do the same thing up above and bring the laterals in there, and then we'll do the second phase of this. You can go study this whole thing. We've written this, we've published it, and we've done it since 1970. And there's very few people do it. You can bring in a lot of permanent teeth straight with very little to left to do by doing this in many, many cases. So I'm going to go on here and we'll take it. All right, when we look straight down at this tooth, here is the lateral tooth, and it extends over to about somewhere like this on this tooth. So we're going to have to cut down, and we're going to have to miss this lateral tooth. We don't want to get close to it. So when we get there close, we angle over here and then pop this off, and now you can see exactly where this tooth is, and you ream out, and then you go down and just obliterate the pulp. Just take it out of there. And now you're going to have to do it over here on this side. So you do both of them, and the tongue will push this over and line it up. I'm going to show you that all the way to that point there. All right, here we are again, and there it is. Now here is the long tapered diamond that we use, and we now use 1171 long carbide burr instead of this diamond. The carbide burr is about this long right here, and you can just get a brand new one each time you do this. If you do the two of them together, you just use the same one, of course, and then you sterilize the thing each time you do that. That's the only sterilization problem we run into with this. All right, in this particular case, I took a Bard Parker, took a little bit of tissue out of there where you could see that easier, and we're going to have somebody rinsing this off and aspirating it as we go. And I've cut down through the tissue, and I'll get out here within pretty close to where this tooth is, and then pull this burr out and cut out a little further, then reach in here with an instrument, pop this piece of the tooth off, and now I can see this lateral coming in there. Now I've got to kind of ream this out so the lateral will have room to slide over in this direction. And I don't want all of it, just push it over, and we're going to do the pulpotomy over on the other side, and these teeth will tend to move over on their own, and as they do, the tongue will push it in here and push it in over on the other side, and just nature will straighten the teeth. And like I say, I've never seen anybody whose teeth would erupt into the place they had to be. They come in and get shoved in place by a correct functioning tongue and lips and swallowing and chewing, and a child that nurses has a better chance of getting them in correctly. But we have a lot of other problems, and that's mixed marriages where we have a large face person and a narrow face person, and the child inherits the big tooth from the larger person, tries to put it in the smaller facial structure of the other person, of that person, and it just doesn't work. So it's absolutely stupid to say we should never take any teeth out. I don't care who you are. People come in with their tooth that they've inherited from a large person into the small child's facial structure, and they just do not fit, and you can take teeth out here. There's a ridiculous idea of just driving everything back so you don't pull out a bicuspid. Now they say, oh, we never extract, we don't extract. They got it like a halo over their head because they don't extract a bicuspid. They don't mention extracting the wisdom tooth because it's going to be shoved further back. They come in, so that doesn't count in this area. And this is ridiculous. You can sacrifice a bicuspid in the middle, bring these back a little bit and these forward a little bit, and many times we get the wisdom tooth to come in. So this is just another good part about doing this. Okay, we're going to take this away right here. We cut that down, and you keep it washed clean and everything, and I can see the pulp chamber down in here, and I've just infiltrated around this and go in here and I get over and just deaden around. That's about all the deadening that I need, but get it good and dead because you don't want any jumping or anything in here. When you get down there, you can see this too. You're pretty close to it. You get it cut over there, and then you reach it in with this one and pop this section off of that. Now it's clear to go in and take that pulp out of that too. We do the pulpotomy. All right, you like that? We took a Bard Parker, but you don't need to do that. It'll do it without cutting the tissue away. Now, I can see this lateral right here. I go and we aspirate here, and you can see now. And so I go in and I ream this out with this long diamond, but don't touch this tooth right here. Leave it alone. So now this tooth can come over a little additional amount, and the tongue will be pushing on this, and you'll relieve the crowding over on this side, and the body, just nature, will slide these teeth over You watch it happen, and it'll do it every time if you've got a functioning, correct child. And that's why it's very important. You get everybody breathing correctly, and if they aren't, spread their palate out, do everything you can to get them an airway, send them to an ENT, have the darn terminates trimmed if necessary there. All right, so we're going down that, and we get the, we're going to ream this out. See, then let's go in and let it bleed. Don't worry about the bleeding of this. That's good. Just take this burr and go on down this bulb chamber that's down here. But we still got this root in this tooth. And so when this cuspid comes up in here, it doesn't hit a void. Over here it would go all the way till it gets to the lateral if you extract that thing. And it'll come over there and it'll move forward. But if you've got the root of this and the root of this one over here, they'll center themselves out, and that takes place. I started doing this back in 1970 something, and this old pediatric dentist from Shreveport came to Fort Worth and put on a program on how to do pulpotomies. And I took him at his word, and he was correct. And I've done, each patient I would do 8 of these. So I've done, I don't know, it's more than 1,000 of them, but I didn't count them anything, but we take that out. All right, I take zinc oxide and eugenol. Just get a little pile of zinc oxide, just chemically pure, and then put a drop of eugenol in there, and you mix that in, and you just keep mixing and packing it and everything, and you take that out and take between Kleenex or some soft paper and squeeze that down until you get all the eugenol out, and then you roll that into a long point like that. Take a spoon and just cut that thing in two, and then you kind of mash it up against it, and you take your spoon and this zinc oxide eugenol, stick it out like that. Now this tooth is sitting over here, and this pulp is open, but it's bleeding up here. Don't care whether it's bleeding or not. Pack this in there. Now this stuff is darn near as thick as amalgam when you get ready to pack it. And you push this down in this hole right here, and then smooth it off a little bit, or I take an amalgam plug or a ported one, go in here and pack it down further. That'll shove it down the root all the way. I don't care if it sticks out the root, it won't hurt a thing in the world. It'll still function and do it. And the tooth is reamed out, over like this, and the permanent tooth is going to slide right in that spot. And then you put another bunch of this hard zinc oxide and eugenol over this and smooth that off, and you don't need a thing else. Every one of those pediatric professors that were at Harvard years ago said, oh, well, we've got to stick something else in there, so they put some form of creosote or whatever they wanted to fill it. You don't need a thing else except zinc oxide and eugenol, and mix the two together. And I have never had one of these fail. And this is in healthy teeth now. This is not an abscess tooth. It's healthy teeth. I did have a sent patient back to the dentist to do this. I tried to show him how to do it, everything, but he was scared to do it. I don't know why. He sent this child to an oral surgeon who was an MD oral surgeon, and he didn't know how to do it either, because he never did something like this. So he just took the nerve down a little bit and just kind of wiped some zinc oxide eugenol over the hole. Didn't know how to pack it, didn't know how to compress it and shove it in there like amalgam. And this tooth went bad on this person. And then some smarty person in Atlanta, I was giving a lecture, called my hand on it, but I did not do that one. And so don't do it. You pack this stuff in and you take your amalgam plugger and go in there and mash it down in place. So I'm going to go on to the next. Now here we go. Don't worry don't try to get this blood out. Definitely do not blow air down there. It's like any nerve canal. If you open a canal on any vital tooth or anything else and just pump air in there, you're going to pump air into the blood vessels. And that's a no positive. So just leave the blood alone. Just take this and shove it right down there. This is as hard as amalgam almost. And you shove it down in there and take an amalgam plug and go in, plug it, and then come in and finish it off. Then I trim up the tooth up here where it won't cut the lip or anything, and leave it alone. If you need to take more off, you can come in and grind. There's no feeling in this tooth. It won't give you any trouble. But I've done this and lectured to so many people. They say, oh God, well, I don't want to go into this pump. I'm just going to cut the tooth off to almost to the nerve. And those give you a fit because they're so darn sensitive. You know, you've got to take the nerve out and you'll be through with this. It won't bother anything. You can come back and trim the tooth a little more or do whatever you want to it. And it will stay there until this tooth comes out by the permanent tooth coming up underneath there and eating the root away when the cuspid comes in. And the root structure of this tooth that's left in there will keep this cuspid from coming too far forward in there. And it is much better to do this than it is to do the extraction. And you have to deaden it to do the extraction. I can do one of these in about the time it takes you to get ready and pull that out. You can just go right down in that thing and take that out, then pack this zinc oxide and eugenol. You can have your assistant learn how to mix this as thick as you can possibly get it, roll it out, put it on a spoon, hand it to you. You shove it down in there and take an amalgam plugger, plug it in, and then smooth that, and then put some on top, smooth this off, and you don't have any trouble with it, and it will straighten up. And we've done this on many people and had that work. So you don't need a rubber dam. In fact, if you try to put a rubber dam here, that's silly, absolutely stupid. Your burr will get mixed up in the darn rubber dam in here. You can't put that rubber dam and see this tooth that's right under the edge of the enamel right here, and you do not need it. You just take a sterile burr, go in there and clean it out. I've never had one of them blow up that I've done. The oral surgeon had this one case that did, and he didn't know how to do this. But he's a fine guy. They didn't teach anything like this to them. Okay, you take that, push it in there, stop the bleeding, come back and get some more, smooth it off here. Trim this tooth a little bit so it's not going to cut the lip or anything or bother. And you watch this tooth that's setting over here now about a third of the way into the root of the cuspid, and yet it stands out over here. Now watch it go back in place. All right. We come over to the other side. We do the same thing. We take it down, but we've got a lot of play in here. This side doesn't even touch anything. So nature will pull that over to that side. We pack it. There's the amalgam plugger, packing it in there. And I don't show trimming at all, but I like to trim it up here. And there we're aspirating that out. Now, this was, I don't think I ever see a date there. But we pack this down and clean it off. And here is 1977 when I did this on this young lady. You see the midline over here? This tooth is already gone here. It's taken up all this space. Got a little bit left over here. When this moves in that much, this tooth, the tongue will push it in here, and the lip will hold it back here. And children don't just jump up and down and thankful to do this. But if I'm not mistaken, this patient right here that came in brought her own little girl back years later and said, Dr. Wyatt, I want you to do the thing you did for my teeth when I was this young. Her little girl was crowded too. Now you've got this, you do it up here, you do it back on your second molars, and you do 8 of these pulpotomies. Go in there and look, I've got the whole thing out there. I've written it, the article on it, I've published it, and people seem to be afraid of doing it. I don't know, it should have. And this has been out for 50 years, nearly about. Well, I guess 77 to, you've got about 23 years there, and we got another 20 years, 23 years now, and it's been there a long time, and it is good dentistry. And if you wanna don't wanna do it, okay. Excuse me. But it works. And you can bring a lot of people's teeth in their mouth and never touch them with braces. But you say, well, how do you charge for it? Well, you figure out a way. Next, I'm going to come back, and there's the first molar will come out. When one of these will go, then we cut the front. We take the second deciduous molar and go in and trim the whole front off, and we leave enough room for the second bicuspid to come in. All right, there it is at that point, and that may be the end of. I just wanted to show you that it is far, far better to do the pulpotomy than it is to extract the tooth. If you extract the tooth, you're going to lose arch length. Now, you say, well, so what? Well, you end up extracting bicuspids, or else you're going to have to take some other teeth out. If they've got room, I keep the wisdom teeth, but if not, we have to lose them. We just don't grow, teeth don't wear down as much as they did to primitive people. Now, look where this tooth has gone. See, it's right up against that. This one still has a little room over on the right side. This will still move over. And I did my own son that way. And his teeth came in beautifully straight. And then we'll come up and take the upper deciduous cuspids out. Now here it's almost over. You see this space right here? And this moves over, this will go away. And now the tooth will come in, and if the tongue is pushing right in there properly, and the lip is catching it out here, these teeth will line up in this area. And I'll tell you, you think people's teeth erupt into their mouths straight? They do not. They come in lots of different ways, and it gets pushed into place by the proper action of the lips and the tongue and the chewing and getting away from somebody prizing their, putting their thumb and finger and biting lips and stuff like that. So I thank you for tuning in here. I'm sorry to take so much time. I want to go through everything that we do orthodontically that is better to do it a certain way than it is another way. And some of it you'll disagree with, that's fine with me. Just drop me a note and tell me about it. And if it makes sense and it's better than what I'm doing, or what I've done, I will change and stop teaching this. But this works, and people just are afraid to do it. It's simpler. They are used to extracting tea, so they do what they are used to. They're not used to doing these pulpotomies, but you can doggone sure do it, and you won't. I have brought people's teeth in their mouth and never touched them with an orthodontic appliance. So thank you. And here's the upper that's being done. And the laterals come in. And that's, I didn't want to take the whole thing up today, but I hope you'll catch on to what we do there. Join our group and subscribe to our channel. We would love to have you. I've been lecturing for years and years, and we've had many, many people we have talked to over the country and in different countries of the world, and I hope that you will join us and drop me a little line in here, and we'll have some people help me answer some of these questions, and I'll try to keep you informed on it. I don't have a whole lot of time left to cover all of these things. I think there must be 50 or more things like this that have been doing that people just have not picked up on. So thank you for watching, and I hope you have a great day. You see, this tooth is right, it'll eat out and come over in the groove sometimes right there. So I'm going to hang up here, and we'll say goodbye.